to 8 days, then there are now more people in hospital with COVID than on the 23rd of March when we went into national lockdown. And while the number of cases is rising more sharply in some areas, it's rising across all regions of the United Kingdom and in all age groups. We know from bitter experience and great personal loss where all this leads. 3 things are now clear. The government has not got a credible plan to slow infections. It has lost control of the virus, and it is no longer following scientific advice. The Sage Minutes from the 21st of September, published yesterday, underline this. They're clear, they warn that a package of stringent interventions is now urgently needed. Sage also says that not acting now will result in a very large epidemic with catastrophic consequences. They warn that just as in the first wave, the burden of a large second wave would fall disproportionately on the frailest in our society and on those on lower incomes and Black, Asian and minority ethnic communities. Among their recommendations is a circuit breaker, a short period of national restrictions that Sage believes would bring the R rate down and reset the incidence of disease to a lower level. Sage's advice is that this could set the epidemic back by up to 28 days or even more. And they're very clear that the more rapidly these interventions are put in place, the greater the reduction in COVID-related deaths and the quicker they can be eased. The Prime Minister has not acted on this advice. In the last 3 weeks, he's introduced 2 sets of far less stringent restrictions, one on the 22nd of September and one yesterday. Both times, the Prime Minister has promised that his measures will control the virus and drive down the R rate. But we now know that this is not supported by the evidence. We also know that Sage has concluded that the £12 billion test and trace system is only having, in their words, marginal impact. We also know that in 19 of the 20 areas that have been under local restrictions for over 2 months, infection rates have gone up, not down. There's no longer time to give this Prime Minister the benefit of the doubt. The government's plan simply isn't working. Another course is needed. That's why I'm calling for a 2 to 3 week circuit break in England, in line with Sage's recommendation. A temporary set of clear and effective restrictions designed to get the R rate down and reverse the trend of infections and hospital admissions. This would not mean schools closing. But if it happens imminently, it can be timed to run across half-term to minimise disruption. But a circuit break would require significant sacrifices across the country. It would mean only essential work and travel, that everyone who can work from home should do so. Non-essential offices should be closed. Household mixing should be restricted to one household, except for those who formed support bubbles. And all pubs, bars and restaurants would be closed for 2 to 3 weeks, but compensated so that no business loses out because of the sacrifices we all have to make. It should also mean that the UK Parliament moves to remote working. A circuit break would also provide an opportunity to reset and to rectify some of the mistakes that the government has made. In particular, to get a grip on testing and hand over track and trace to local authorities. A circuit break will have to be accompanied by extensive support for jobs, for businesses and for our local economies. Because if we're requiring businesses to close, we must provide the financial support necessary to protect people and our local communities. Because every job matters and every business matters. Introducing these kinds of restrictions isn't something anybody wants to do. This was not inevitable, but it is now necessary if we're to protect the NHS, fix testing, and get control of the virus. I also want to say this directly to the Prime Minister. You know that the scientific evidence backs this approach. You know that the restrictions you introduced won't be enough. You know that a circuit break is needed now to get this virus under control. You can't keep delaying this and come back to the House of Commons every few weeks with another plan that won't work. So act now, break the cycle. If you do, you will have the votes in the House of Commons. I can assure you of that. You don't need to balance the needs of your party against the national interest. As the Deputy Chief Medical Officer said just a few days ago, we're at a tipping point. But if we act now, if we follow the science and break the circuit, we can get this virus under control. If we don't, we could sleepwalk into a long and bleak winter. That choice is now for the Prime Minister to make. I urge him to do so. Thank you. Vicky.
For weeks, local leaders, including lots of Labour mayors, have called to be more involved in the decisions that are taken for their area. You're now talking about a return to a blanket national approach. Isn't this going to be a huge cost to the economy? And isn't it better to have a tailored approach for every single region? I
do think local authority leaders and mayors should be much more involved in the process. Joint decision making, not a veto. We've been calling for track and trace to be with them for a very, very long time. But what this is about is a break to the circuit to make sure that we get the R rate down so that in all of those areas they can get the virus under control much more quickly. And in relation to damage to the economy, I think the damage to the economy will be caused by weeks and months of the approach the government has set out. This will break the circuit, bring the R rate down, and give us the chance to get back in control of the situation. Kate.
Kate McCann from Sky News. You've just said that we're at a decisive moment. You want to see more action, and it's urgent, it must happen now. Yet tonight in the House of Commons, you had the opportunity to do something to force the Prime Minister's hand. You could vote against the measures that he's trying to introduce. And unless you want to correct me, you're not going to vote against them, but you're not going to vote for them either. So if you don't think it's the right plan, why not vote against? And if you're worried about not having any measures at all, why are you not going to oppose them?
Well, I think the restrictions that the Prime Minister is introducing are obviously the second set of restrictions in just 3 weeks. I don't think they go far enough, which is why we need a circuit breaker. And we need that now. That is the message I'm getting across. But tonight on the vote, we're not going to vote down a package of restrictions because restrictions are needed. The problem with the vote in Parliament is a take it or leave it vote. If you vote it down, there are no restrictions. Nobody in any of the areas where the infection rates are going up is calling for no restrictions. So it's in the national interest that we have the circuit break now, but we will not vote against the restrictions in the meantime. Robert.
So are you talking about a lockdown more or less identical to the first lockdown, except that schools would remain open? And have you costed your proposal to help both people and businesses?
It's very similar to the first lockdown. It's in line with what SAGE was recommending, but we don't want schools closed. It's much more important we keep our schools open. But there is the opportunity, if we act now, to have this circuit break over half term, which means that for a week, even 10 days if you take the weekends into account, the schools would be shut in any event, which would help a great deal. In terms of the costing of it, The broad answer is that if we don't do this, the cost of the economy will be much greater in the long run. And that is really important, because if the R rate continues out of control, it will be the economy that pays in the long run. So this will actually save money in the long run. Thank you very much.